Hello friends, welcome back. In the last lesson, we looked at health and health models and we reviewed 5 such models. I will now present a case which would make the understanding of these models more clear. I'm sure you will be able to work your way through and understand which model applies to which part of the case management. This is a case of a 16-year-old girl who comes because she has recurrent complaints of upper respiratory tract infections. Not only at every seasonal change, but even in between, she gets these infections, which may start with a bout of cold, sneezing, and that later develops into a cough. She also states that her menses are scanty and delayed, very irregular. On further questioning, we come to know all these complaints started after her grandmother died 3 years ago. As a matter of fact, nobody ever talked about it at home. She was kept away from all the ceremonies. She was kept away from all the grieving, thinking that she was too young to handle that tragedy. So she was never allowed to really grieve. And that is when all her problems started. Some of you might have already rightly guessed that grief is an element that enters into this case. But does it really have relevance, and do we have a medicine for that, which also combines with all her local complaints? Is there a grief related to the current complaint? How are we to know that? That is where our conversation will lead us to. The next thing is it a valid causation? Because when we saw the physiologic model and we were talking about causes, then if it is an external pathogen only that we are looking for, is it a valid cause to consider grief to be the trigger for all these ailments? Also, is there a grief medicine really? Because what happens in normal practice, as we'll see, we'll come down to a certain number of practices in the current medical model. Of course, we know that grief does have certain outcomes in terms of symptoms and syndromes. For example, it can lead to a heart attack in extreme cases. There is also something known as a Takotsubo cardiomyopathy, or the broken heart syndrome. And of course, there is atrial fibrillation. In other words, arrhythmia, or the heartbeat becomes erratic or irregular in cases of grief. In that case, the practitioners will resort to a heart medication, or they'll resort to a antidepressant if it's purely just a case of grief related mood disorder. Many of you may be aware of the concept of somatization or embodiment of a certain disturbance at the psychological or mental level, which can manifest itself at the body level. So somatization, or the process of embodiment, is a process through which the body absorbs social stresses and will manifest itself through symptoms of suffering or disease or illness. For example, there is a term called susto, and this is very commonly used in Latino communities, people who are from Portugal or Spain, and even if they are away from their parent country, which they left many generations ago, as the populations are in South America, they are native Spanish and Portuguese culturally influenced populations. They recognize culturally that there is something known as susto, which is called a fright or a shock disease, which is often found in grief. It doesn't find mention in contemporary medical literature. It is attributed to events such as losing one's loved ones or a terrible accident. And the symptoms can be of a wide variety. They can lead to appetite loss, lack of motivation, breathing problems, a generalized pain, nightmares, and many other things. So indeed, it is recognized in other practices that through somatization, there can be physical manifestation because of psychological disturbances. The common approach for these things in the present allopathic model is CBT, cognitive behavioral therapy, interpersonal therapy, antidepressants, hormone therapy, etc. Each one targeted, and if it is something like a broken heart syndrome, then of course you'll have, for atrial fibrillation, you'll have some heart medicines also. And you will be involved with 5 or 6 specialists, a psychiatrist, a psychologist, or a psychotherapist. And of course you'll have an endocrinologist and a general physician. So there'll be at least 4 or 5 people taking care of that person. And I'm not criticizing or commenting on the worth of that kind of an approach. But we are here to understand how a homeopath would deal with it. It's very simple and yet it's very deep acting. Let us consider the homeopathic treatment in the case of the girl that we considered a few slides ago. The homeopathic treatment was a remedy which must address all the local symptoms. So it must address her menses, it must address her upper respiratory frequent infections, recurrent infections, and it must also address anything deeper than that. There is a suppressed grief which we discovered during the course of our narrative medicine session. The remedy in this case was Ignatia amara, or simply we call it Ignatia. So this girl was given Ignatia, and after having taken that medicine, she said that she was sad and tearful for a few days, but at least she was tearful. Earlier it was a suppressed grief where she could not express herself. In fact, she was also not allowed to appear sad in front of others. And after that, she was feeling much better. As a matter of fact, her infections reduced and her periods returned to normal. So it was a beautiful case, and it's not very difficult once you understand the methodology and the models that we have used. You can just sit down and try to understand which models have we put to use in this particular case. Let us take a little deeper look at the remedy Ignatia. We are using the term here called the spirit because there is a very good book written by Dr. Rajan Shankaran from India, where he takes a different, deeper look at every homeopathic remedy. And this is what he explains about Ignatia. He says that the nature of this particular medicine is like that of a woman who has invested her entire emotional bank balance into one individual. The fact that that girl started having all these problems after her grandmother passed away, it must have been a very deep shock, and the practitioner has learnt that it left a very deep impression on a young mind. When there is a loss through death of that person, it produces a feeling of being ruined. So these are the words that Dr. Rajan Shankaran uses to describe this medicine. Of course, there's a description that follows in the next slide, and you'll have to read the whole book in order to understand and get a grasp of Ignatia, but this is what is relevant in this particular case, and I'm quoting that as much. So Dr. Rajan Shankaran continues in the spirit of Ignatia that there's a tremendous grief, anxiety, brooding, and shock. This element makes it the remedy for most people who are faced with the loss of a dear person in whom they had invested a great deal of their emotion. And as we saw, this remedy worked beautifully. Just after a few doses and a few days, she was able to grieve, she was able to come out of it, and she was relieved of her respiratory problems, which became fewer and less frequent. And of course, her menstrual problems were entirely solved. That brings us to the end of this lesson. I'm sure you must have got a fair idea about the importance of the different models of health and illness and how they can affect our approach to solving a case. Thank you very much for your attention, and we meet once again in the next lesson. Until then, bye-bye.